Welcome everybody. Hope you're having a good morning so far. My name is Tim Proctor. I'm a product owner here at PCC. I work with Tamsin and Bastian here as well. We work on a delivery team at PCC focused on reporting and forms. We've also been working on some billing tools and so forth as well. I also have some experience as a dashboard developer for our dashboard product. We'll get into that a little bit and talk about some clinical measures in the dashboard in this session. Tamsin here, who's assisting, is our QA analyst, soon to be moving on to a new role at PCC. Bastian is our developer, working on clinical reports right now, actually. So, yeah. So goals today is I'm hoping to just give an introduction to various operational and strategic clinical reports. Some folks were in my class yesterday. We talked about financial reports. Today we're going to talk about clinical oversight reports. And we're going to get into reports mostly in the EHR. There may be a couple reports in practice management that I'm going to talk about, but most of the clinical reports we have are all in the EHR product. And I'm hoping that folks can get as we go through the session, and by the end of the session, you can kind of get a recognition of maybe some areas at your practice, some clinical areas that you may want to go back and take a closer look at, that you may realize need a little bit more oversight. And think of ways that you can address that at your practice, who you can talk with at your practice, maybe some operational changes that you might want to make or think about. That's what I'm hoping you can get out of this. Hopefully you'll learn about some new reports, new information that maybe you hadn't explored in the past. I will mention that in the app, in the UC app, there's a second handout. There's a presentation itself. There's a handout of exercises as well. This session goes till 12, so we have a lot of time. We may have some time towards the end to get some practice and get you logged in on your system and playing around and running some different reports and generating some information. So those exercises, maybe later on, we can get in. If we don't have time in this session, it's definitely something you can take back. And these are just examples that I put together for practice. If you have questions, by the way, raise your hand if you have questions. I'm happy to address that throughout the session. If there are online questions, I don't know, Tamsin or Bastian, if either of you are looking at online, if they come up, feel free to let me know and I can address those as well. So here's basically the structure of what we're going to talk about today. I'm going to start with some operational oversight reports. We're going to get into the reports listed here from phone messaging, portal messaging, portal activity reports, vaccine inventory, patient communication, orders, prescription reports. So we're going to talk first about some operational reports like that. And then we're going to get into some clinical strategic oversight reports. And these are the dashboard measures and clinical measures, well visit rates, immunization rates, screening rates. So I'm hoping to show you where all of those measure results are stored in the dashboard, how you can get that, how you can understand how they're calculated. We'll talk a lot about that. And then finally, we're going to get into population management. So, and this is recall. Like, how do you get lists of patients from the EHR that you can reach out to, or lists of patients that are maybe due for vaccines or due for well visits or other services, as well as care plan oversight. So if you have patients that are in need of special care plan and frequent visits, and you're tracking care plans for them, well, how do you get a list of those and manage those patients? So that's population management. We'll get into that as well. We're going to start with some operational reports. The first one I'll mention has to do with phone encounter responses. So this is a report. We've had this for a while before the report library even existed. So that's why it's listed elsewhere. Under the reports menu, you'll see it as phone encounter performance. And basically what this is going to show you your phone encounters for a given date period and time period. And it's designed to show how long, or it's meant to show how long it is taking for phone tasks to be responded to. Just a show of hands, how many people have done patient-centered medical home recognition at your practice? Yeah, so this is PCMH recognition from NCQA. This is one of the things historically that you've had to show is that your practice is tracking how long it takes to respond to phone calls that need a doctor's response. Same thing with portal messages. So this report is designed to show the phone encounters you've opened and the time it takes for the first task in that phone encounter to be checked as completed. So when you run the report, there's a filter for task type. This is where you're specifying the tasks that need a response. Doctor's attention needed, nurse's attention needed, something that the tasks that require a callback or response. All right. The output of this report is a little bit antiquated. It's something that exists outside of the report library, but you get some columns there. You can save it as a CSV. You have some other columns that you can choose to display as well. But you can see there's a response time calculation, and really that's what this is it's a report you can use to just show that you're tracking response time to phone calls. And there's some optional columns you can show, including the user who took the call, user who completed task, and other information. In the report library, in a similar way, there's a portal message response time. So if you're interested in seeing, okay, for all the messages you're getting from patients, portal messages, how long does it take to send a response to that message? And that's what this report is doing. And you'll see it in the report library under the portal reports category. It's called portal message response time. Okay. A few other portal reports you'll see in the report library under the patient portal category. And there are reports that basically provide information about portal accounts and activity that falls into that for those accounts. There's a variety of different reports here. I list a few, but if you're ever interested in seeing just an activity log for a given portal account, you have reports in here for that, the portal user inactivity audit. If you ever want to see payment details, so portal payment details, if you're taking payments via the portal from your families, you'll see those payment details on that report. Portal message audits, as you're sending and receiving messages, those messages will be accessible via a report under portal message audits. You can get a list of families or patients that do or do not have portal accounts assigned to them. So I think I have some examples in these coming slides here. These are a few here. If portal activity for a patient, like I mentioned, if you want to see the activity log, the logins, like the last login, who's been accessing the portal account for a patient, that first report is good for that. portal users linked to a patient. You can specify a given patient, and it'll show the users that are linked or assigned with those patients or connected with those patients. And then the portal user list is a larger audit of who has been created and added to the portal user list during a specified time. So if you want to get a list of all the portal users that your practice is adding, you can use that portal user list report. Yeah?
What report do we use to see what patients don't have a portal?
I think it's the first one here, patients with portal users. When you run that, you can see it. I think there's a filter of portal user or with portal user or without portal user, and it'll give you a list of patients that that do or do not have a portal user. And like I said here in the table, you can use this to send a message to groups of patients that to improve sign-up. So if you want to get a list of everybody that doesn't have a portal user assigned, you can send them a text broadcast message saying, hey, remember, sign up for the portal on your next visit. Or you can send, if you want to reach out to people that you know have portal users, families of patients that have portal accounts, you can get those to announce changes to the portal. Like, hey, we're starting self-scheduling. Try it out. Or we're adopting pre-check-in. Use this. So if you want to reach out to people that have portal accounts, this is a good report to use to do that. And again, that's just using broadcast message once you get that list of patients. We'll talk more about broadcast messaging a little later too. Just to back, okay, so I talked about those reports. Portal users by appointment date. So if you want to know for upcoming appointments who does and does not have a portal user assigned, that's a good report for that. You'll get a list of appointments, so your front office staff can get a heads up about get this patient, talk to this patient about signing up for the portal if they're not already signed up. Portal users by relationship. So this will allow you to see the portal users, a list of portal users or patients that have a portal user assigned and the relationship that is assigned for that portal, for the portal user, the relationship to the patient. So you can get a report for that too. All right, talking about vaccine inventory management. So there's a QR code that has documentation. We have lots of documentation on Learn about vaccine lot manager, like how to store vaccines and how to use reports to manage that inventory. We have 4 main reports for inventory management. So these are really helpful if you're using vaccine scanners at your office. All right, just show of hands, who's using vaccine scanners at your office? So if you're managing your inventory with scanners, all right, these reports can be helpful just to reconcile your vaccines on a regular basis, just to make sure what you have according to the stock of what you're scanning matches what you're actually given. Okay, we'll talk about some of these reports here. All right, so I think I have some slides. So yeah, this first one, vaccine inventory reconciliation. If you want to compare your inventory in the EHR, okay, so all the vaccines that you've documented in the EHR, whether you're using scanners or not, what inventory you have with what you've actually given. Okay, you can filter this various ways for different lots, lot information, locations, funding sources, and so forth. But the output that you get from this looks like this. All right, you get each immunization lot with an expected inventory column, and then other columns are left blank because it's meant to be a worksheet that you would print out and have somebody sort of just reconcile what the inventory, the EHR has for inventory versus what you actually have in your fridge, just to make sure that that matches up. Show of hands, who's using this report at their practice? Okay. It's really useful. Do you guys find it useful if you're using it? And
Especially for like your monthly stuff you have to report to the state. It's good. And then they use it to make sure for our private that we've got everything, we've got everybody that we should order for.
yeah. So it's good to reconcile, and it's good to also catch mistakes. Like sometimes you may give a private stock when you should have given VSC or vice versa. We have a report. So if your inventory doesn't match what you, if the EHR inventory doesn't match what you actually have in the fridge, you can use an immunization administration details report to determine, and basically that gives, I don't know if I have a screenshot of that. No, I don't. The immunization administration details will give every single vaccine you've given for a specified lot, just to make sure that it matches what you've expected that it was that you gave at your practice. So it helps you determine, like if you maybe missed a lot number, if you're not using inventory scanning. Sometimes you may miss a lot number or that may have not been entered. You can catch that with that report. Immunization admin counts will show a count of immunization for private versus VFC lots. And yeah, that details report is really good to dive into it if you find some discrepancies. Okay. Moving on to communication. So patient communication oversight. We have, under the report library, we have a communication category with a variety of reports. I'll talk about a few of these. You can audit and review your broadcast and single text messages. So if you wanted to get a log of all of your broadcast message batches that you sent out, that second one there, the broadcast message log, will give you that. The details, the first one will show detailed results of all of your message logs, whether how many failed, how many were sent successfully. So it's always good to kind of monitor your messaging, and if a message fails, you'll know that maybe a phone number was wrong, or you may need to follow up on that. But these logs can be helpful for tracking down or just getting an idea of how many messages were sent successfully or not. Inbound messages will show you replies sent to broadcast messages. So you send a message, a text message, if somebody hits reply, which they can do, all right, you won't ever see it, but this report can show you that message, all right? So if you wanted to view replies that somebody may have sent to a broadcast message, you'll see them in there. And lastly, the single text log will give, if you're using the single text messaging feature to families, that will give you a log of those text messages sent by your practice. Yeah.
We have two questions.
Sure.
Okay, so number one, if a patient is not set up on the portal, can they still receive text messages through PCC?
If a patient is not set on the portal, I believe so. And
Yes, they
yeah,
can.
Dan's nodding yes. So the send text message feature, and I haven't used this in a while, but I think you just plug in a phone number, and it sends a message to that number. So yes. They don't have to have a portal account.
Okay, number two, do we get charged for the amount of texts and emails we send to remind for an appointment?
There is no charge for texts or broadcast messages or anything that you're using within the EHR. The only charge, I believe, is if you're using the Notify program.
Yes.
For sending reminders.
So it's very confusing. Is that confusing?
Yeah. Yes, the Notify program is it's a program we've had for a while. It's used for appointment reminders mostly. Some people use it for recall. You can do recall messaging, text messaging for free right from the report library, and it's actually you have a lot more control over your messaging and so forth. Notify is the only one that has a fee. But anything sent from text or broadcast message from the EHR is free, no charge. All right. Okay, so I talked about these communication reports. Orders by visit. This is a really, really useful report for getting a list of orders that, or any order type that you've given in a particular time period. And you can filter it by status, obviously by order name. But if you wanted to get a list of, I think I have some examples here, a list of referrals. Okay, referrals are orders in the system. If you want to know, show me a report of all the referrals I've sent in a given time period. You can filter it to a specific referral type or referral person or practice. If you're using different orders for different referrals, you can do that. Or screenings, like if you wanted to get a list of all of the depression screenings you've ordered in a given time period, you'll see that. In addition to the list, you get a count, right? These reports have a subtotal, a count in there too. So a lot of times people want to know, okay, how many different screenings have I done in a certain time period? A report like this is really useful for that. Dan, yep.
Should I do it in the mic?
There is one here. Yeah, go ahead.
So one thing I do want to mention is that there's the orders by visit report. There's also just an orders report. The orders report, which is also marked as a data source, actually is a little bit more flexible than this one. This will just look at orders placed on appointments or visits, whereas the orders data source will look at also look at orders placed on phone notes and portal messages.
Yeah. Yeah, so Dan's example, the orders by visit is an appointment-based report. You're putting in an appointment time period. So it's orders on those appointments. I think it would be just the orders data source, right? Like in that same report library category, we'll show all orders regardless of whether they're attached to a particular appointment. Clinical. I think you'll see it in clinical. It might be in other places too. Yeah, very useful report for just getting a list of any particular order. Labs are the exception. Actually, labs ordered. So I think labs are on there. Immunizations are the exception. Immunization orders are not reported in here. Speaking of labs, we have a report called test results under clinical reports. If you ever need to get a list of your COVID tests that you've done, or I know people have used it in the past for that because they needed to report all of the tests they've done, or any other lab tests. This report will give you that, along with many details about those labs. Okay, you can see the example there. You get your result, you get the LOINC, interpretation. So any lab orders, if you wanted to get a detailed report of those, this is the report for that. Okay, going to jump into strategic. Any other questions before we move on about operational clinical reports? Yes. Yeah, so the question for folks is the inbound messages report, what number are they texting to get there? Like when you're sending broadcast messages, you're obviously reaching out to individual cell phones for patients. When they hit reply, I think it's I don't know if it's a practice. It's not a practice number. It's a practice identifier. I don't know.
The local number that's attached to your practice.
And is the same phone number that goes out for broadcast message the same phone number that you do when you hit send text?
Yes. Yes.
And then each practice has like a different phone number, so.
Yes.
And then
Yeah.
if they respond to that same one,
Yes.
Notify number is a different number.
But notify is
Yes.
a different number,
Yes.
okay.
It's like a.
No, yeah. Notify is definitely different, completely different than this.
And that one doesn't.
Yeah. Yeah, for folks that are streaming, I want to repeat this. So we were just talking about the number, that the practice number that is being replied to when messages are sent out. The question was, is it different than what the notify number, messaging number would be? And yes, it's completely different for that.
We have a question from streaming also.
Yes, okay. I did want to point out inbound messages. So that report is there for email, SMS messages. So that's the other thing worth mentioning is email. Sometimes you send broadcast messages via email. Replies to that email also come in here. The single text log, Dan, do we know the single text replies? Would that also show in inbound messages?
No.
Is it just broadcast message replies?
Inbound messages, yes.
Yes, okay.
The single text log, I should probably say this in my show. Sorry, my bad. So the single text log will only show the outbound messages from your practice sent through the send text button. The inbound messages will contain all replies to your emails or SMS sent through broadcast messaging or send text.
Yeah. I know there's a question online. Yes, but let's
I
go
didn't
here.
realize till yesterday that if a parent opts out of either email or text, whether it's the send text or whether it's the portal or whatever, that all the things you guys do that are not notified are linked together. So if they say, ugh, I don't want to get these reminders, whatever, and they opt out of anything that's PCC, they opt out of everything that's PCC. So I don't know if everybody knows that. I didn't know that.
Yeah, so what was mentioned is when a patient opts out of communication, which they can do with the messages, they can reply to opt out. You will get an indication of that, by the way, in the patient demographics. You'll see there's like a little icon that indicates they've opted out. When they opt out, they're not getting broadcast messages, send text, email,
I mean, it would be one or
portal
the other.
notifications. Yes, yeah, that's another big one. Yeah,
They opt out of either text or email. It's not both. They opt
It's
out
separate.
per phone
Method.
number or per email, yes.
right.
But if they thought they were opting out just for some portal thing, for example, they're also opting out of you being able to do a send text to them.
Correct.
Yeah, they're opting out. When patients opt out, they're opting out of portal messaging, any sort of messaging from the EHR, essentially.
Can you run a report if who's opted out?
Can you run a report of who's opted out? I don't know.
I mean, you can use the broadcast message details or the broadcast message log,
And it tells you.
and it tells you if they've unsubscribed,
Yeah. So
but only for that run that you did. You can't run a report to see everyone that has unsubscribed. Right,
yeah.
Dan? Yeah.
Okay.
Hold on.
Yeah.
Question?
It's just the same in response to like if they do opt out when we hit send text, does it prevent us from sending the text? Or does it? Or do you like think you're sending it, but then
It doesn't stop you at the time you're sending it.
or it doesn't show up as an option, right? It wouldn't show up as an option.
Oh,
Okay.
okay.
So it prevents you.
Hold on. Dan's going to give a more detailed answer to that.
So it won't show up in your list of drop down. It won't show up in the quick access. It won't show up in the list, but it doesn't prevent you from typing it in. Which, you know. Right. Right.
The question from chat or from the streaming was, in the broadcast messaging log report, is there a way to see which numbers were SMS failed?
Yes,
And the answer, yes.
yes.
And somebody also commented, it would be nice to have an unsubscribe report.
Yes, yeah. You can't get globally for all of your practice, all of your patients who has unsubscribed. We will make note of that. That would be a good thing. But yeah, individual broadcast message logs will indicate who you sent a message to that is unsubscribed. But that's individually with that particular batch of messages.
I got a question.
Yep.
When you were saying that the number wouldn't be available, but it doesn't stop you from keying it in.
Typing it in. Yeah.
If you type it in, does it override and gonna send it anyway, and they have to opt out again? Okay.
No, sorry.
Yeah, Tamsin's done a lot of testing in the past with all of this stuff. Yeah, it would not send. It will look like it sends, but they won't actually get it.
You can, in the chart, right click, or there's a little icon you can click, and then it gives you the option to send them a request to opt back in. Like if they're in the office and they're saying, oh, I didn't mean to unsubscribe from everything. So there is that. That's only in the chart, though.
You can only send the request if they've unsubscribed their email. Yeah, because okay, right. So there's a button for text. There's a button for phone numbers. But if you open it up, what it says is tell the patient to text unstop. Because stop actually stops it at the carrier level. You cannot send anything to them anymore. Oops.
Sorry, not my product. Not a good excuse.
All right. Any other questions related to text broadcast messages? I'm going to talk more about how to do broadcast messages when we get into recall and examples of that. All right, we talked about orders. Let's get into some strategic reports and some dashboard things. The first thing I want to mention, hopefully people are familiar with what this is. This is the Bright Futures Periodicity Schedule. And whenever I talk about clinical oversight for the strategic side and improving the clinical health of your patients, this is the sort of the holy grail, right? This explains really from when you start seeing them to when they exit and transition out of your practice, all of the recommended screenings, services, immunizations, and so forth that they should get. So it's good to think about, like, are you missing any recommended preventative care opportunities? Like dental varnish is a common example. That's been recommended for many years. Some practices don't do it, or maybe don't understand exactly when it's recommended. Depression screenings, other screenings, developmental screenings, and so forth. So definitely good to kind of refer to this just to identify the opportunities that maybe you might be missing. All right, the dashboard. All right, the dashboard, when you first log in, there's a clinical pulse. This is your overall clinical score for the practice based on the measures listed here: well visit rates, immunization rates, ADD patient follow-up, sick to well ratio, diagnoses per visit. You can see the category weight of each measure. So if you're wondering how that pulse is calculated, this describes that, and it actually gives you the math and how that's calculated. 40% of your overall pulse score is based on well visit rates. Okay, so that's the highest weighted category for your pulse score. So obviously, if you want to improve your clinical pulse, that's a great place to focus. In addition to immunization rates, which is 30%. So those two are 70% of that overall clinical pulse. Okay, you can see this page right in the dashboard when you go to clinical pulse. and you'll see your trends for your pulse score. Yes?
Are the well visit rates of a kid that transfers to you when they're 3, they start from when they come in?
Are the
Or
well,
are you supposed to go back and put some kind of historical code that, yeah, they had their well care before they came?
the question was, are the well visit rates for kids that transition to your practice as of when they started? So when they transition to your practice, absolutely you should get their past, you should know when their last well visit date was. You're not, obviously not putting in all their visits necessarily into the EHR, but their date of last well visit is important to have in there. And there's a date field within the patient demographic record where that can go. And yes, with the minute they come in, they're an active patient, they will count on whatever well visit rate age group that they're in, they'll be in that measure. And they'll be up to date if you backdate their well visit, and they just had it.
Up to date on that one, but there could be some other, like if they come when they're 7 and they were missing and they got their 6, you typed it in, and they got their 7 with you, but what about their 5s and 4s?
The earlier ones, yeah. They only, the well visit rates in the dashboard, every active patient counts in one age category. So the measure result that you see updated regularly counts that patient once based on their current age. So if they missed a well visit in the past years ago, you're not going to get dinged in the dashboard for that. It's just looking at whatever age range they're in now, like did they have the recommended well visit within the last year or whatever. And yeah, the dashboard counts patients based on their current age, and then there's a snapshot of that each month. Inactive flags. Let's talk about flags for a second. So clinical measures in the dashboard will exclude patients if they are inactive at your practice, and that could be they could be marked as inactive with any given flag, or not seen in the last 3 years. Okay, so you have a patient flag table. This is about to be transitioned to the EHR, but right now it's in the practice management side. Every individual flag entry has a question. I should have circled it in the screenshots. The last question of exclude these patients from reports. If that is set to yes for the individual flag, any patient with that flag will not count on clinical measures in the dashboard. All clinical measures. They'll be excluded from all clinical measures. Yes, question about that.
So that's loud. We have patients, let's say, who has an alternate vaccine schedule, and we have that flag on them. But if I put yes to that, they will exclude from the vaccine.
The challenge, they will exclude, but they will exclude from every measure.
Got it.
So probably not a good idea to mark that as exclude from reports, because they'll be out of well visit rates and all that stuff, when you really want to count them for other stuff.
So how often should you be reviewing those? Because if I added some sort of new inactive and I retired something, does that default just because it has the word inactive, or is it specific to the name of the flag?
It is not specific to the name of the flag. It is set individually by you guys when you're adding these flags. So you shouldn't have a need to add flags too often, but it's important when you do add flags to pay close attention to what you're setting for that. When you hit A in the flag table to add a new entry, the default will be, I'm pretty sure, is no for all of that stuff. So yeah, just be careful with it when you're adding new flags, and review. I mean, this could be homework if you haven't looked at your flags table in a while. Take a look at it. Check each flag entry and see what the question is set to. If you have inactive, everybody has inactive as a flag. Transferred, dismissed, those should all be inactive
One
or
more
exclude
question.
from reports.
The tildes, anything with a tilde, if it has a tilde, not included, right?
No, the name of the flag has nothing to do with whether they're included in the dashboard. It's that. It's only that last question. So if they're tilted, meaning you don't want your practice to use it anymore, you want to move it to the end of the list, the tilde has no impact on, it's that last question. And yeah, COVID vaccine only. So like when you were seeing kids during the pandemic and they were only getting COVID at your practice, so they're not really your patient, make sure those are flagged because you don't want them counting on well visit rate reports. Hospital only is another common one. That's another good example. If you see a kid in the hospital but they never actually come to your practice, mark them as hospital only and make that excluded from reports. All right, so the dashboard will exclude patients that have any flag marked as inactive. I should mention, actually, we're talking about the patient flag table. There is an account flag table, and that same question is in the account flags as well. If the account flag, or if a patient's account, billing or home account, has a flag that is set to be excluded from reports on the account flag, that patient will also be excluded from the dashboard. So the patients themselves, you can look at their flags, but also look at the account flags too. Okay. All right, PCMH dashboard. So in the dashboard, there's a PCMH tab. This is for patient-centered medical home. We designed this years ago, and it's a little out of date now because PCMH recognition has changed a little bit. If there's annual reporting that you're doing, you're not referring to these exact QI measure categories and so forth. So we probably do need to update this a little bit, but it's designed to give you a summary of all of the clinical measures for your practice in one page and easy access to detail and results, current results, on one page. So it's really useful if you want to just jump to like a summary of measure results, numerator, denominator, percentage, and change over the last 3 months. It's useful for that. It does include the percent change over the last 3 months. For PCMH, you have to show that you've made improvements, that you're tracking your trends over time. That percent change column can be useful for when reporting for that. There is towards the bottom of that PCMH page, there's a way that you can see measure results by provider, by PCP, and by other categories, including insurance, and race, ethnicity, and so forth. That we have that breakdown for some measures, not all, but a few measures. Percent of patients up to date on well visits. So just to talk about the well visit rate measures in the dashboard. Obviously, it's an indicator of recall effort, preventative care focus at your practice. Only active patients seen in the last 3 years are counted. So patients flagged as inactive or haven't been seen in the last 3 years, if they haven't been seen in 3 years, they're automatically excluded. Low percentage of patients up to date indicates opportunity for recall, opportunity for more well visits. All right. We're going to talk about this later, but you can use the report library to get the up-to-date recall lists of overdue patients. All right, the dashboard, if you click on any well visit rate measure in the dashboard, you'll see a page like this, and we break it out into sections for each age range. And you'll see your practice results compared to the client average. The top 10% of practices will have a benchmark for that. And then there's some other HEDIS benchmarks for each well visit rate measure as well. Towards the bottom of any the well visit rate measure page is a trend. So you'll see your monthly trend for each line represents a different age group. there is the ability to save that as a spreadsheet if you want to look at your monthly trends for well visit rates. I included this slide because I want to explain that under 15 months. We often get questions about that well visit rates for kids under 15 months and really how that's calculated, why your result is 0%, or you may be getting a result that you're not expecting. This is based on the standard HEDIS measure, which counts active patients having 6 well visits before age 15 months. So the denominator, the patients included on this measure, are those that turn 15 months old in the past year. Okay? We're looking at kids who've recently turned 15 months. Did they have 6 well visits by that 15-month age? Okay? It's not looking at patients currently under 15 months old. So you're not seeing what are my well visit rates for the kids under 15 months. It's a retroactive or retrospective measure. If the patient misses the measure, so they don't get 6 by age 15 months, okay, they'll continue to show as overdue until they move to the next age group category, until they turn 27 months of age. And there is a restriction in the measure calculation. If sometimes you add patients after 6 weeks old, or like they join, they're born, they go to one practice, but they come to you, I don't know, like when they're 3 months, 6 months, or something like that. They wouldn't have had the opportunity to get 6 well visits by age 15 months because they got some elsewhere. All right. So patients whose first visit was greater than 6 weeks after birth, first visit with your practice was greater than 6 weeks after birth, they are excluded from this measure. We don't count them because they wouldn't have had a chance to get 6 well visits. So that's just an explanation of that. It's a retrospective measure. All of the other age groups are looking at patients currently in that age group and if they've had a well visit in the respective look-back period. All right, you can get a breakdown for well visit rate measures. If this is helpful, if you wanted to get an idea, okay, what are my well visit rates for kids of each age for each insurance group, for patients that have a primary insurance assigned to each insurance group? So you can see your well visit rates with a payer mix. Are my Medicaid patient well visit rates different than my Blue Cross patient well visit rates? So you can monitor that as well. You can do it by provider. All right, does one provider, and this is by primary care provider assigned to patients. Does one provider have better well visit rates than another? You can break this all down by race, ethnicity, sex, so other criteria as well. So you can get to this from the detailed breakdown link in the dashboard. So on the well visit rates measure page, you'll see a link for detailed breakdown. A little bit about recall and revenue opportunity. So you can fairly easily calculate the revenue opportunity for your practice by doing some recall. So just by looking at and getting a count of patients overdue for different age groups and knowing what your average deposit is for a well visit for those kids in that age group, you can easily calculate annual opportunity for recalling X number of patients based on what you're actually getting paid. So this example here, I just plugged in some numbers with some benchmarks based on national PCC data of average deposited for the well visit, including everything done in the well visit, screenings, immunizations, so forth. You can get an idea of what the average deposit is and what your opportunity is. So it's good to look at this. If you want to put a number, a dollar figure on really the financial opportunity of doing recall, this is a good thing to look at. And you can be realistic for the numbers. If you have 1,000 patients in the 12 to 18 year range that are overdue, you're not going to recall all 1,000 of them, maybe 500, even half of them or 2/3 of them. You can calculate some numbers. Okay. We're going to talk more about how to run recall reports in a little bit. But I want to maybe just hear from folks. Does your practice have a recall process? What are you doing at your practice to recall? Does anyone want to share? Yeah.
I can share.
Yeah.
Love other people's insight on this. So we make 5 attempts to recall our patients. We recently were not using any of the recall reports. We used visit task to recall our patients, but then we found out about the recall report and how we're missing patients that don't have a task assigned to them for recall.
Tell me more about the task. So you're giving a follow-up task?
Yeah, so
in
the
visit?
provider assigns a task that says next well visit due, and they assign it to the front desk. So the
Okay.
front desk has thousands of open tasks, and they're using this to send recall. Like, we do 5 attempts. So our first attempt is a text message with a link to portal scheduling. Second attempt is a phone call. Third attempt is, what's the third attempt? An email? No, third attempt is a text message with our phone number. Fourth attempt is an email, and the 5th attempt is a postcard.
Okay.
And then if they don't answer by that, then we review them for dismissal. But we recently found the recaller report, because not every patient has a task that hasn't been in our office, so we're missing all of those patients. So I would love some insight and just to hear what everybody else does and how many attempts you make. Do you document each attempt in the chart? Like, what is your process?
Yeah. Okay, let's talk about it. Yeah.
So I use dashboard. Every time it comes out, I go to my dashboard and I look where I'm at, and I go to where I'm not performing well, whatever well check it is, and I work my way down to work those to get them in the green. So that's how I do it, and I go right to that report, and I do my broadcast from there.
So you're
Or
looking
recall.
at the dash. Are you looking at the dashboard overdue lists?
Yeah, I'm looking at the dashboard to see where I'm hurt, where I need to focus. And then I go to broadcast messaging and
Okay.
pull my reports based on what I find in my dashboard. So
Okay.
that I'm kind of doing 2 in 1. I'm cleaning up my dashboards and getting us to a healthy place. But I use broadcasting to send out all those messages.
Good.
Do you ever look at the efficacy of that? We don't really get a whole lot of uptake in electronic pinging people. We don't get a whole lot by phone either. If they're gonna come, they're not gonna come even if we handle it. Do you think it works?
I feel like it does. I will say, every year, we really focus on it when we're fixing to go into our summer months, because that's when you want to see all your well checks. And we fill it up every year by using it. I mean, if you get 10 out of the 2,000 you sent out, I mean, that's 10 that you probably wouldn't have got to answer your phone.
Yeah.
So,
Tracking
and
it.
it's not hard. Like, you
Right.
just do it and you send it and you don't worry about it.
Tracking
but we-
the efficacy of it is interesting. And in the back, you guys tracked. Did you somehow track in maybe a spreadsheet or something like that? All because you have 5 different.
Yeah,
How
so
do you
we
know
just-
if you've sent?
So
a
we've
third
just
or-
started this with the task because we found that patients were getting like 11 recall attempts. Sent text to schedule, and they never did. So we were like, okay, 5 times and we're done. So we're doing
Yeah.
it by the task, and we're noting each attempt in the task, like attempted
Gotcha.
recall 1, attempted
Okay.
recall 2. But I don't know if this is the most efficient way to do it.
Yeah, I think it's interesting that you're using different methods, right? Because I think that's good, right? Like, if you're sending a text message all the time and you're not getting any improvement, try something different. Like yeah. So I like that. What are you guys doing?
Yeah, so we make kids coming in for their checkups like our number one priority. So we schedule their checkups when they come in, not after the appointment, because you'll lose a lot, and we schedule a year in advance. So
Yeah.
that keeps us on task. And then we lose some people, and then I look at the dashboard every month, and anyone that is, I mean, it will tell you if they're overdue, but they're scheduled for a checkup, so we leave them alone. But if they're not scheduled and overdue, then we'll contact them. And if they're just a little overdue, then we just do a little inter-office message, call the parent, and they schedule, because they're just fell off the radar. But if they're very overdue, we know it's a family that doesn't contact us very well, then we'll make usually a phone encounter, just so we have an encounter in our visit history, and everyone can see that. It's better than flags, because that means that we know when they call the office or anything, you can see that they're overdue, and we'll ask them to schedule it. We'll make a phone encounter and call them, and then we might send a portal message. And the great thing about portal messages is it tells you if they've read it, right away. That's a big deal, because if you send them portal messages and if they're unread, then it's not going anywhere.
You know, so
And
you have immediate.
So I tell
yeah.
the team, stop sending portal messages. They're not reading it, and then we call them, and then just to keep my staff from going crazy, if they're not responding to our phone calls, we'll start spacing them out. You know, like every 2 weeks, or then every month. You know, and then we'll just do once a month, and sometimes like after like 5 months, they like schedule it. You know, but then after many months, and they've had no interaction with the office, then they've moved on, and we just inactivate them, so we don't keep on getting frustrated. But it's worked, pretty well. You just got to get to know your families and know what's going to be effective and what's not.
Yeah, Dr. Hirsch mentioned one important thing is like you schedule it before they leave, right? Like that's the key.
At check-in, yeah, you schedule at check-in, and you do it a year in advance, and
We do it a year in advance, we do it at checkout.
yeah,
A lot of times we're like,
yeah.
So did you say what do you do with the dads that don't follow up? I mean, I do, but.
So what we hear from dads is, because we have a lot of dads who bring their kids to their visits, and dads say, oh, my wife will schedule the follow-up appointment. I don't know, her schedule, my wife will do it. So how do you guys overcome that?
Yeah.
We do have a suggestion from if folks don't mind, we've sort of left them hanging. So Jackie Woods says, we use Notify for first contact 2 months prior to due date. Then they use recall reports, and front desk works those lists, text phone call 1, phone call 2, portal message, then task for 1 year from last visit, sick or well. If no appointment that time, review for dismissal, or inactivate if not dismissal.
So that's kind of similar, I think, to what you guys were doing, just different tasks and.
All right, let me
follow-up.
do a follow-up.
The other thing that's helpful is that so we periodically run a report, because we do schedule a year in advance, so you can run a report of patients who are due for a checkup in the next 1 year, but who have not scheduled that checkup yet. So and you can sort it by age, because, if they're a teenager, then you'll put them at the bottom of your list. But if it's like a 3-year-old who hasn't scheduled the annual, or a 2-year-and-a-half-year-old who hasn't scheduled their next checkup, then we're going to call them. And that's real easy. That's real low-hanging fruit, because you get them on the schedule. About the dads, so path of least resistance, okay? So usually when people come in, because these kids are in school, we see them during school, we want to make it easy, and so when they come in, it's maybe 10 o'clock on a Tuesday, we'll say, okay, 10 o'clock on a Tuesday, how about next year, July 17th, same time, does that work for you? Yeah, okay, same time, that works for me. And just put it there, and then the parent can call and move it, but it's much better to schedule it and then move it, 'cause at least you have a time blocked for a checkup at that spot in the future, because if you don't schedule up until the last minute, you might not have space. So just say, hey, does the same time and day of the week work for you? And it's like, oh yeah, sure. Just go with it.
And I think a key is having flexibility in your schedule, realizing that they may actually call and change it later on, and you got to accommodate that. Yeah.
Yes, and it's kind of back what he was just saying. When they go to check out, sometimes they'll make it out the door and they don't even check out because you're waiting on somebody else and they just scoot around and all the things. So our front desk staff just know to go to that same time next year on the schedule, at least a year and 1 day out, and same time, same day of the week, and go ahead and put that on the schedule because they get that reminder 3 months out before the appointment, and they're able to call and reschedule if they don't want it. And then most of the time, they don't even remember that they didn't schedule it. So they're just coming for the appointments. But it's on there, then we're going to follow up with it when we start sending the reminders. So it eliminates that task, it goes ahead and closes it, and you can move on.
Yeah.
I have
think
another one from the from online.
Before we get into that one, I think the general theme is schedule it in advance. Just get it on your schedule, get it on the books. That's a key strategy. Yeah, Tamsin.
Okay. Melissa Lenahan says, your families will get used to scheduling a year in advance. Their dentist offices do it. Our front desk has even gotten the older patients to schedule for themselves. It helps them taking part of their health care and gets ready for adulting.
Mm-hmm. Yep, absolutely. And we're going to get into... I think I heard a couple others. Yep, visit tasks or follow. I've definitely seen people do follow-up orders.
The doctors put them in as a
Yeah.
task when they check out, but we just close it because we're not putting it on the schedule. So we're not having to worry about following it up.
Yeah, the challenge with that can be like prioritizing that task queue, right? That comes up, it gets big, right? Right.
So we will order the well visit reminder for a year, but we would set it out for 6 months in advance. Like you could change the due date. So we set out for 6 months, so it's not in our queue sitting there. But when it comes time to start scheduling them, it'll pop up for the front desk to start reminding them to do it.
Yeah. So tasks, using tasks is a good suggestion. Setting it 6 months ahead of when they should come in is good.
And we have another comment that they also automatically schedule in advance if the patients walk out.
Mm-hmm. Yeah. We're going to get into how to actually run these recall reports. I want to make sure everybody knows how to add restrictions for scheduled visits to identify patients that may have already scheduled their well visit or kids that are due but haven't scheduled. We're going to get into some of those reports just to make sure you know how to generate those. Let's talk about immunization rates. All right, in the dashboard, there's this is a screenshot of a PCMH dashboard section, but all of these different immunization rate measures are in the dashboard. Obviously, it excludes patients with inactive flags, like I talked about earlier. I want you to know that historical and administered IMS are included. All right, so if you add historical IMS to a patient, that will count in here. It will go towards the immunization rate. That's why it's so important for especially the childhood IMS, patient 2 years old. Any vaccines they get at the hospital or elsewhere, make sure your staff are putting in those historical vaccines in order for these measures to be accurate. Childhood immunization rates, this is just a graph that you'll see in the dashboard. If you drill into detailed breakdown for the childhood immunization rate measure, you'll see your rates for each vaccine in that series, okay? With combo 9 and combo 10 on the right. Combo 9 is everything but influenza. Combo 10 is the more common measure of this, industry measure of this, and that includes 2 influenzas by age 2. So you can see your practice versus the average.
How did you get to that?
I'll show you. I think I have the dashboard open somewhere. Let's see.
While you're doing that, I'm just going to mention there was another suggestion from the chat to track our overdue WCC recallers. We rerun the identical report every 2 weeks to track the total number differences.
All right, immunization rates. Patients 2 years old, so this is one we're talking about here. This link right here, the view detailed breakdown, we'll get into the breakdown by vaccine. You could do this by primary care provider as well.
You went into productivity?
I went into the actual measure, immunization rates patients 2. So you can also pick it from here. Yeah, I just went to that one and then detailed breakdown. You can get your list of overdue patients right from here too. So that's kids overdue for that individual vaccine. Okay, we don't have a list for kids overdue for the combo, but you can get your list of kids overdue from here as well. All right. Yes, question over there.
So combo 10 is supposed to have 2 flu vaccines, but if you look at the 2 stars, it only says 1. I don't know if you actually noticed that. Or if it's just a typo, or if it really is in the formula. Go down to the very bottom and look at the 2 asterisks.
Oh, I think it is a typo. Yeah, should be 2.
I think under 2 is 1, over 2 is 2.
I think it's.
I could be wrong, I know,
I'm pretty sure the measure calculation is looking for 2 by age 2. And I think that asterisk down there is a typo. And I think it's been there for a while. Yeah.
And then the 2 rotas also, because some of us have,
Yep, 2 rotavirus by age 2.
depending on the type.
Oh, is it sometimes depending on the type of vaccine given, they might only need 1?
There's 2 different brands. There's one brand that's 3 doses.
Gotcha. So this calculation I know is just looking for 2 regardless of brand. Yeah, 2 regardless of brand. I'm going to talk about, so we're actually going to be updating this measure very soon in the report library, and I'll talk about that in a second. Adolescent immunization rates, also in the dashboard. If you click on immunization rates adolescents, the same thing, detailed breakdown, you'll get a page like this. You can see percentage of patients that had 2 HPV by age 13, 1 meningococcal, 1 Tdap. It's labeled as HEDIS Combo 2 because that's the industry name for this, but it really is Combo 3. They have to have all 3 of those vaccines by age 13 in order to meet that combo. Talk a little bit about adolescent depression screening. Yeah, so this is one of the screenings recommended in the Bright Futures periodicity schedule, starting at age 12. Average payment for this across PCC clients is $6. I know some people don't get that much. Some people don't get anything. But this measure is included in the dashboard. Just in this, the way we show it in the dashboard is percentage of active adolescents that had any of these billing codes listed here billed within the last year. So percentage of patients that had a well visit and a depression screening in the past year. Okay. We have an updated version of this measure coming in the report library very soon. Bastion may be working on it right now. Yes, so I'll talk about that in a second. Infant developmental screening, this is another dashboard measure we have and you can see it's recommended at the 9-month visit according to the Bright Future schedules. Some people do it at different ages, but the measure itself is looking at The way we calculate it is the measure of infants getting developmental screening between 6 and 12 months of age. So it's looking for one screening billed between 6 and 12 months of age. And we did that because some people do it at 9 months, some people do it at 10. So we're looking for it during that time period. And there is a breakdown by PCP for this one and the adolescent depression screening too. Yeah, correct. I don't believe we have that overdue list in. Yeah, I don't know. Right. Yeah, so, and to recall them, yeah. Weight assessment and counseling. This is a standard, another measure that's pretty standard in the industry. Patients 3 to 17 years old that have had BMI documented, nutrition counseling, and exercise counseling. Okay, you'll see this in the dashboard under that weight assessment and counseling, and you'll see a measure for each BMI, nutrition, and exercise counseling. A lot of people are low for this measure, particularly the counseling parts of this. If you are, excuse me, talk with your client advocate because there is likely a configuration issue with the screening order that you're using. The way this measure is calculated is based on a SNOMED code. So it's looking for an internal SNOMED code attached to the screening order. And I've seen it many times where a lot of people don't have that code assigned properly. So if you're low on that, let us know. We can guide you through fixing that. Multi-location practices. We added this years ago where some of the measures, I think we have it for well visit rates, immunization rates, there is a location drop down in the upper right, okay, if you are a multi-location practice. This will show your measure result for patients attributed to that location. We attribute patients to the location of their last well visit. If they haven't had a well visit, it's the location of their last sick visit. But that's how the location breakouts are done. All right, coming soon in the report library. We're working on these now. So we are and this is planned for the next release, the fall release. Screening for depression and follow-up plan. And you can see the measure description here. Childhood immunization status, weight assessment, counseling, documentation of current meds in medical record. We are planning to add these to the report library with the ability to choose whatever reporting period you want and be able to filter by provider, filter by location, and subtotal by provider, subtotal by location. So we're working on adding these in the report library. Eventually we'll update the dashboard so that you can get a benchmark for this, compare your practice to other practices. The way that these are calculated are what's called standardized measures. So every year there are measure specifications that are updated. As we built these measures and the queries for these measures, they are based on the latest latest specifications for it. So this will be good if you're a practice doing PCMH recognition for your annual reporting. You are required to use what they say standardized measures. We've heard from many practices that, practices are using the dashboard measures, which are great, but many practices are telling us that NCQA is requiring standardized measures calculated in a specified standard. So we're working on adding these. And these are the first 4 we'll get. ADHD follow-up is another big one that practices often need to do. Like how many percentage of patients that have ADHD that have started medications and followed up with your practice. So there's a measure for that that we'll take on as well later on. All right, population management. So let's talk a little bit about some recall reports. The The first one, care plans by date. You'll see this in the clinical reports category in the EHR. This identifies any patients that have a care plan assigned to their record. And you can filter on various things. But if you wanted to identify those patients on a care plan and also just kind of get a summary of what their goals are, what their next steps are, what you've documented in there, when it was last reviewed, maybe you need to follow up with these patients. And how many folks, just show of hands, use care plans at your office in the EHR? Okay. There is a specific component, and the EHR care plan component has specific questions or specific documentation that you have, goals and next steps. You can see some of them here. It's good to use because it's tracked chart wide, right? Like you can, it's not attached to individual visits, although you can have it in the visit component as well. But it's just a place where you can go to just monitor their care plan, update their care plan, and update the notes related to it. And you can report on it. You can report on patients, get a list of patients that have a care plan, an active care plan on their record. People use this. So for the folks that are using it, can you just say what you're using it for? Which patients are you tracking it for?
We use it for our asthmatic patients, for asthma maintenance and medication, as well as our ADHD patients.
Yeah, asthma patients. So they use it for asthma patients, medications, and ADHD patients. Yeah.
Obesity.
Yeah, obesity and tracking that, tracking goals, and yep. Yep.
We do it for any chronic, that's, condition that's gonna follow a provider, if medications are having to be monitored. We do a care plan because of course we're PCMH certified, and you have to show where you're updating that care plan monthly and that they're staying up to date on everything. But it also helps, our care coordinators with like medications, because instead of having to go back and look at chart, it's in the care plan, they update, like if they're trying to get an approval for a medication, or a change in a medication, they have it in one spot in that care plan where they can just go look and see what, instead of having to go back and each encounter and see where the change was made.
Yeah.
So it's been very helpful.
Yeah, it's good to just have a spot that you can go to monitor and update. And I should have added some screenshots of it if for folks that aren't aware of it. But you can track, what is it? Drawing a blank on what it is. The families and specialists that are attached to that patient in the care plan. There's a place for adding all of that. Documents and notes you can track in there too. This all shows in the portal as well, so patients can see their care plan and maybe refer to their goals and next steps right in the portal as well, which is good. So yeah, this report is really useful for just identifying those patients that have a plan that maybe you need to follow up, maybe you need to recall them or check in with them. Recall in the EHR. So we'll talk through this and go through some examples. Preventative care recall gives you a customized list of patients who are overdue for well visit. You can recall or get lists for specific age groups with various different output columns of contact information. You can use broadcast messaging functionality, so you run the report. At the very end, you can export and send as a broadcast message, no extra cost, as we talked about earlier. Oh, and you could schedule recall lists. All right, so you can create a recall report that is scheduled to run for you at the beginning of the month. So you don't even have to remember to generate that list. It'll do it for you and filter it and get that restricted output right for you. It cannot automatically send a broadcast message, That you actually have to run the report and do, but you can at least get the output without having to even build the criteria. Okay. Well visit recall. So we're gonna, this is, consider this a little cheat sheet on how to get how to use the report library, patient recall, preventative care recall, and how to restrict that to get the output that you want for a list of kids overdue for a well visit. All right, I'll walk through this as an example, but yeah, restricting on flag, age, due date, and also excluding by scheduled appointment. So kid has a well visit coming up. They may be overdue now, all right, and maybe due coming up, but if they already have one scheduled, you don't need to reach out, all right? That's one difference. The dashboard does not exclude kids that already have a scheduled well visit. It's still going to consider them overdue, and that they'll be on that overdue list.
But it tells you that their next visit is checkup.
Oh, that's true. It does list it, yes. Yeah. That's
Tim,
right.
a question from the stream. If you create a recall report for WCC, can those families receive a text or email reminder?
Yes. Yeah, you can build a recall report, restricted in various ways by age and so forth. And when you run the report and get it on your list, and I don't know if I have a broadcast message enabled in my demo environment here, but when you view the output, there's is it export? I think an export button. Press that, and you'll see the ability to either print, save as CSV, or send as message, or send as broadcast message. So going to that export option, you'll have that choice of sending as a message. So any list, any patient list, and really I think any report that gives you a patient list in the report library will allow you to have that broadcast message functionality. All right, so we'll go through an example of this. We'll also go through an example of a chronic condition recall. Very much the same. You use that chronic condition recall report in the report library, and the only difference is it has a clinical diagnosis restriction. So you can say, show me kids that have ADHD, or kids that have depression, or any specific condition that may have not had a visit in X number of months. And so you're excluding if they have a scheduled appointment coming up, but you're also excluding them if they've had a certain charge or a certain visit recently. If they had a visit recently, they wouldn't be overdue. So you can use that criteria to get kids that are due for a follow-up for a certain condition. Oh, and vaccine recall. So you can identify patients overdue for vaccine, for any particular vaccine, with this overdue vaccine recall report. Under the immunization category in the report library, you run that, and it's going to prompt you for vaccine. You can exclude patients by flag and so forth. But like this example here includes a list of kids that are due or past due for a rotavirus vaccine. People use this. You can use this for HPV. Like I think an example I have coming up is patients 9 to 11 years old that are due for an HPV, that need an HPV, and get a list of those. You can send broadcast messages to those patients. The great thing, by the way, about broadcast message, I can't demonstrate that in here. You can type whatever message you want. I mean, you're limited in characters, but that's a big difference between notify within practice management. That is, notify is set with a specific message or prompt. Broadcast message allows you to type whatever you want, which is nice. All right, so let's go through some examples. I'm going to walk through examples of doing well visit recall, just for folks that maybe haven't experimented with this much. We'll do an immunization recall as well and talk about scheduling reports too. Let me make this bigger. Whoops. Oh, I don't know what's going on. Jeez. Okay. Under patient recall, all right, I'm going to run this preventative care recall report. And remember the slide I had earlier about the different restrictions that we'd want to add here, and I'll just walk through it. You want patients that have had a visit in the last 3 years. Okay, that's the default. We'll leave that as is. We want to exclude patients by flag. So I'm going to go here and say, let's exclude patients that are dismissed, inactive, transferred, unborn, or other things here. Yeah, so exclude those. There's also, again, by account flag, so any patient that has a parent that is dismissed, inactive. Generally, patients themselves would have these flags, but sometimes if you have a parent that has a specific billing flag that you don't want to recall them for whatever reason, you can include those flag restrictions there. Physical due. So here we want to say the default is all past days through the next 90 days. So that's going to get patients that are overdue, so due in the past, or coming due in the next 90 days. I'm going to leave that here, but you have various choices of all past dates through next 30 days, 60 days, 90 days. So I'm going to leave it as 90 days because I'll get kids that are coming due soon. And here I'm going to give my restrictions. So I want to run this for kids for my adolescents, so 12 to 18. And I recommend when you're doing recall like this, break it down to different ages. Like somebody said, like go in the dashboard, look at what well visit rates you're low on. It could be the 7 to 11-year-olds, 12 to 18-year-olds. Focus on them. Focus on certain populations at a time. So adding that filter is good. And then I want to exclude patients that have a scheduled appointment coming up. So I'm going to say exclude patients that have a scheduled appointment in here you can say, I'm actually going to go next 365, or you can say next 90. But any patient that has a well visit already scheduled, I'm going to leave them out. And you can change that appointment date. You can filter that however you want. But it is important to say, okay, I want to only leave them out if they have a well visit scheduled. So I'm excluding patients that have a well visit. So searching for well and selecting all will make it easier to just choose everybody that has a well visit appointment type. And I just double check to make sure I'm including all the true well visit appointment types. And you can filter by location too. I don't need to do that, or provider. And that's it. So if I want a list of kids overdue for well, I don't need to do anything else. I don't need to exclude by charges or order. I generate that list. All right, so these are my adolescents that are currently overdue for a well visit. There are 485 of them. It will tell me the last physical date and the next physical due date, so I can see a lot of these kids are long overdue. And I have all the columns displayed for the particular report I'm running here. So for folks that want to be able to export and send as a broadcast message, you click that export button, and I don't have it turned on here now, but you will see a broadcast message option here to be able to send as a broadcast message. Or you can save it as a CSV or PDF. Whoa. Did I hit something? I know, I don't know how I did that. This trackpad is doing some funny stuff. Oh. Yeah, I did something with the trackpad. Oh, wait, yeah. Oh, jeez. I don't know what's going to, yeah, all right. I'm not going to touch it. All right. Yeah, so that's a list here of patients overdue for well. You can customize this report. Now, here we go. If you want to get some different column outputs, I'll just cover this real quick about customizing these reports. By default, I had specific columns there, including last physical, next physical due. If you wanted to see their flags, if you wanted to see their PCP, and other stuff here, you can choose to see those here by just customizing that report. If you wanted to see their last visit date and last visit reason, age at last visit. So there's lots of, I just want to point out, there's lots of different columns. Oh, what's going on? There's lots of different columns that you can, it's weird. Oh, there is a mouse here, I just realized. It might be easier. Oh, yeah. Hour and a half later, I realized there's a mouse. All right, so yeah, customizing reports, scheduling the report. So if you say, okay, this is a really good adolescent well visit report, I'm gonna save it here now. Give it a name. You can say how, if you wanted to save it, run it monthly. It'll ask you the day of the month, the time of the day. So I can schedule this report to run for me. And scheduled reports will show in a separate tab up here. So these are your scheduled reports. The saved results, any report that was scheduled that you want to refer to will show in the saved results. Let's do another example, a recall example. Overdue vaccine recall. So say I wanted to get kids that are due for an HPV vaccine, say 9 to 11-year-olds that need to come in for an HPV vaccine. Again, I can exclude by flag. Let's do a few of these here. Say kids 9 to 11. And say, all right, in here you can filter on the vaccine family. So I want HPV. And you can specify due or overdue. So that's what we want. I don't quite know the difference between due or overdue, but that's the default. If you want kids, identify kids that are due or overdue for HPV. There you go. This is including patients will include patients that are coming in soon for appointments. So if you want to identify the kids that are about to come in that are due, just to make sure that you have an appropriate supply of vaccine or are making sure that you are prepared to give them a vaccine. So you can do that. Or you can take that out completely if you wanted all patients, regardless of when they were coming in. Let's do that actually. Generate that list. You'll get a list of kids that are due for HPV. It gives you the recommended date and the due date, so you can tell when, based on vaccine forecasting, when they are due for the particular vaccine. You have the insurance, so you know which insurance or if there will be VFC or not. So Yeah, getting a list of kids due for vaccines can be useful here too, and this report will get that. Yeah.
Is there a way to make a report just for due for the second one?
Good question. So the question was, is there a report to get a list of patients due for a particular dose? And there is, and it would be a different report. Let me see if I can remember. Under immunization, this one, patient immunization administration summary. So I'm going to leave the flag exclusion, but yeah, normally you do that. You can say, show me kids 9 to 11 that had 0 or 1 dose. Okay, not 2. Well, let me see if this actually gives what I'm thinking. Yeah. So, so I think this should give what we're looking for. I'm not going to get any good data in this database, but specifying 0 to 1 HPV vaccines will only show those that had 0 or 1. If they've had 2, they wouldn't be on this list, even though they've had 0 or 1. It's filtered to just those that had 0 or 1 on record. So I think this would give what you're looking for.
So everybody on this list needs the same one.
Or you can do 1 to 1.
Already had one, and they need 1 to 1.
Yeah, 1 to 1. This was showing kids that hadn't had any as well. Yeah, so 1 to 1.
Tim, question, can we cross-check if they need or are due for a well check in addition with that report?
In addition to this vaccine report, or
I believe it was.
Let's look at the output here. I don't think so. I think it's. I'm wondering if we can get well visit. Let me see if I can customize that. I was just wondering if we can see last well visit date. Doesn't look like that's in here. So the vaccine report does not show last well visit date or due date for next well visit. They would have to use that separate other patient list report for that. But yeah, patient immunization administration summary is good. And actually, I'm going to jump back because I'm realizing I had been on a different report. So overdue vaccine recall. Has last visit date, next reason. I don't see next physical due date or last physical, but we have last visit.
There was a clarification that it was when you were running the HPV report.
Yeah. It doesn't look like we can include last well visit in here. Let me see if there is criteria maybe. No. So not combined with the HPV if they're due for a well. The vaccine forecasting and the patient lists are kind of separate data sources there. Okay. Yeah, so I wanted to go through a couple of examples of those. We're almost at time, so any other last questions? Yeah.
So for the overdue immunization reports, some patients who refuse certain vaccines, will they show up in the overdue report as well?
If they refuse vaccines, okay, good question.
Like not all vaccines, but like specific vaccines. So like in our practice, we have patients who refuse the HPV vaccine. Like, will they also show up in the overdue report as well?
They do. So they will show up in the dashboard as overdue, and they will count as overdue in the dashboard. This report we'll show them as overdue as well. There is no restriction on refusal status. If you had a flag that indicate that they're refused, you could have a flag assigned to exclude them by flag. But yeah, they are not on the vaccine recall report set to be able to be filtered. We do have refused.
Recall just a second dose, because I don't want to recall the people who refused, when their kids are not. So that's how you would get around that, I think. It's the only recall who needs a second dose.
Oh, then you'd get the kids that had at least one dose.
Parents have agreed to one, but not the younger kids who refused already.
Yeah. Go ahead.
I don't know if this is if a lot of practices have this, requirement, but for Medi-Cal or Medicaid in California, the requirement for a well child check is not defined as 365 days after their last visit. So for us, it's like a total different configuration, and I don't know if it's possible, because for me, as long as it's done in the calendar year, it's considered you're due for your checkup. So somebody last year in 2024 could literally do a checkup in December and then could literally be due, everyone becomes due January 1st of 2025. And so the state does not care that it's how many days afterward, and for a billing purpose, they also don't care either. So I have trouble, and my reports are like completely all off because we're calculating by 366 days after the last time, and so it's completely messed up for me. I don't know if it's possible to.
So there is some back-end configuration in PCC of calculating that next due well date, because that happens automatically. Like, you'll notice, you pull up any patient, next date due for next well visit. I don't know if you can change it, but that date is actually calculated in the back end. You can configure how that's calculated, but for your case,
It's like that will like never meet.
yeah. Well, you can do it by last visit, right?
Yes, there's two ways to do it. I was just looking at it to remind myself. There's two ways to do it. So the ones that are for the younger kids, where you go in by like their specific month, that's absolute. That's looking at their age. So that's calculated, off of their date of birth. And then once you're in the, the 3+, where typically it's once per year. Those are typically set up as a relative, so that'll go off of their last visit date, and it'll try to put it 53 weeks after their last visit date. I was looking at it to see if there was a way to get it to go by calendar year. I don't see one that we have right now in this setup that we have right now. That'd be something definitely for us to consider as we move this stuff over to the EHR.
Yeah, I'm just trying to think of a way to report and filter it to get that list of kids that might be due. Well, I wonder what here. So one thought I had, and we can follow up on this in a little bit because we may need to dig into it. You could use this report. Don't do anything here, physical due, but say exclude if they had a well visit this year. Yeah.
January 1 to today's date.
Right, year to date. And there is a year to date, so you could say here and then select the well visit procedures. Yeah, all of those, and yes, and so so you may be able to do it that way.
You can also do it by excluding by scheduled appointment.
Oh.
And so if you exclude by scheduled appointment, you can probably just set it up to be this entire year, Jan 1 to December 31st, and just let that go, and then update it once you hit the next year. That could be a way to do it as well.
Yeah. So you're getting a list of all kids that have not had a well visit this year, essentially, or don't have one scheduled this year. Yeah.
And then say appointment days.
Yeah. So what I did, I changed the physical due. I just took that physical due out of it. So it's not looking to see at the due date for next visit, for next well visit in PCC. It just doesn't look at that at all. It just looks at, did they have a visit yet this year, or one scheduled this year? Yeah. Okay. We're just about at time. Any other last final questions?
I do have one that's kind of like, on the Practice Vitals dashboard, we have that measurement, immunization rates, influenza, asthma, and it's always 0. It's, everybody's is 0, because it's nothing to compare it to, but is that hurting our dashboard numbers by being present, and what is it calculate? Like,
Yeah,
what is
I'll explain that one, this one here. It is everybody is 0 starting in July. It's meant to be a seasonal flu vaccine rate measure. Same thing for the regular seasonal flu. Like you see here, everybody's 0, the client average is 0. That should go up each month as you start giving vaccines. So we reset it in July because people sometimes start getting their flu stock after July, usually September, maybe September-ish. And so everybody's 0 now. You'll see that go up. It shouldn't impact your...
But you have the immunization rates influenza.
Yeah.
That always shifts and goes up. I have a hard time figuring out what this one was actually.
Yeah, so influenza, so that one, influenza rate, immunization rates, influenza is, I don't know why, that one should reset as well. And this is a typo, this is wrong. The only difference is that it's looking at kids with asthma, the immunization rates.
Diagnosed with asthma is that first one.
Yeah.
But the immunization rates influenza doesn't sit 0.
This one didn't reset to 0. I would expect it should. And it reset. I know it resets in July each month, each year, and will go up because it's the start of a new. It may start next month with the next data load in August. Yeah. I will say right after lunch, there's a reporting walk-in clinic. So we're happy to talk about any other recall or other clinical reports in that session. But that's it. Yeah, thanks. Enjoy lunch. You're welcome. Safe travels for everyone that's leaving this afternoon.